Breg's T-scope hip post-op brace is designed to provide protected, controlled range of motion for patients recovering from hip surgery. The brace is comfortable, simple to apply, easily adjustable for a personal fit, and features a user-friendly hinge to control the range of motion in the patient's hip. When worn correctly, and for the length of time prescribed by a medical professional, the brace helps post-surgery patients recover comfortably. T-scope hip braces will not prevent or reduce all injuries. Proper rehabilitation and activity modification are also an important part of a safe treatment program. Patients using the T-scope hip should consult with a medical professional regarding safe and appropriate activity levels while wearing this brace. The initial application of the T-scope hip braces should be performed by a medical professional only. Only a medical professional should adjust or change range of motion hinge settings. The hinge on this brace is designed to limit and/or control range of motion. It is not designed to stabilize the hip when patients are weight-bearing or take the place of a walking aid. Patients should follow their physician's advice regarding weight-bearing and always use a proper assistance device, such as crutches or a walker. While you can adjust the range of motion hinge when the brace is on the patient, it may be easier to make the adjustments to the hinge prior to applying the brace to the patient. To adjust the hinge, pull back the hinge cover padding around the hinge and adjust the range of motion stops if necessary. To adjust extension limits, pull the tab out and slide it to the desired setting, between -10 and 70 degrees extension. Similar to a speedometer, on the hinge there is a combination of numbers and tick marks that represent the settings. For example, here's 30 degrees extension, and here is 40 degrees extension. To adjust extension limits, pull the tab out away from the center of the hinge and slide it to the desired setting. Make sure the tab is secure in the correct position. Flexion limit settings may be selected between -10 and 120 degrees, shown as the last tick mark on the scale. The hinge may be locked by sliding the red quick lock button into the lock position at any one of the 5 positions. -10 for extension, 0 for neutral position, or 10, 20, or 30 degrees of flexion. Then just replace the hinge cover. Now we're ready to fit the brace on the patient. Our first step in fitting the brace is to measure the patient's waist at the navel level using a standard measuring tape. Begin by removing the Y tab and belt end guard from the ends of the waist belt. Trim the belt to match the patient's waist size using the waist belt rulers included on the brace as a guide. You can also fold the end of the straps of the waist belt to the desired waist size if you don't want to trim it. Replace the Y tab and the belt end guard onto the straps. Now the brace is ready to be applied to the patient. Ensure the pull tab is released to allow the lacer housing to be fully separated. Position the waist belt at approximately the patient's navel level. Make sure the center of the lacer is in the middle of the patient's back by pulling both sides of the belt an equal distance away from the body. Next, make sure the strap lock clips are in the up position. Then slide the cuff so that the center of the cuff aligns with the patient's lateral midline. You can slide the cuff onto the proper position by hand, or you can move the waist cuff by pulling the extension prevention strap. Secure the strap lock clips onto the waist belt. Remove the extension prevention strap Y tab, trim the strap to length or fold it over as I'll demonstrate, then reapply the Y tab and secure the strap onto itself. If the cuff was moved by hand, tighten the extension prevention strap. Now tighten the lacer by pulling the lacer pull forward away from the body and then secure the lacer pull to the waist belt across the body. Adjust the telescoping waist hinge bar by positioning the middle of the hinge to the center rotation of the patient's hip, usually aligned with the patient's greater trochanter, and lock the telescoping lever into place. It's normal to have a space between the hinge and the body. Adjust the telescoping thigh bar by placing the thigh cuff at the desired position and lock the telescoping lever into place. Wrap the thigh strap around the leg and attach the thigh strap buckle to the hook on the thigh cuff. Remove the thigh strap Y-tab and pull the strap, making sure the thigh strap is snug at all points around the leg. Trim the strap to the desired length or fold it over as I'll demonstrate. Replace the Y-tab and affix it to the distal thigh strap. Pull the tab attached to the D-ring on the thigh strap until the strap is tight. Readjust range of motion hinge stops if needed. Patients experiencing any increased pain, swelling, skin irritation, or any adverse reactions when using T-scope hip braces must contact a healthcare provider immediately. After initial fitting and application, the T-scope hip brace may be removed and reapplied by releasing the waist belt and thigh strap. The thigh strap can be released by pulling the tab attached to the D-ring and unclipping the buckle. And undo the waist belt. It's as simple as that. Hand wash the foam pads and straps with mild soap. Rinse thoroughly with fresh water and air dry. Do not place pads or straps into a mechanical dryer. If you have any questions about how to apply T-scope hip braces, refer to the instructions for use. If necessary, the telescoping hinge bars can be contoured to an abduction-adduction angle or to increase or decrease the offset of the hinge. After contouring the bars, they may no longer telescope, so setting the length first is imperative. To find the correct position for the hinge placement over the greater trochanter, have the patient flex his or her hip by raising the leg. Remember to set the range of motion stops to the desired location prior to applying the brace. Even though it's possible to adjust them once the brace is on, it's easier to do with the brace off the patient. Make sure to separate the lacer housing as much as possible when wrapping the belt around the body to ensure enough compression when the lacer pull is engaged. This can be achieved by removing the lacer pull before applying the belt. Make sure the telescoping locks are in the fully unlocked position to ensure the bars are easier to adjust. If the proximal thigh cuff just below the hinge is causing any pressure, try to rotate the entire brace slightly forward so the waist cuff is more aligned with the lateral midline of the patient's body. All of the straps and waist belt can be fit without trimming if necessary by folding the loop material as many times as needed and utilizing the Y-tab to close the end.